Just a little background about myself. So I was here at Stanford as a medical student from 2005 to 2009. I then transferred over to the East Coast to finish my training at Brigham and Women's Hospital as an internal medicine resident. And since then, I've been working as a hospitalist in the Boston area. I worked last year as an editorial fellow at the New England Journal, and currently I work as a consultant for clinical strategy at the New England Journal as well. So to start this talk, I want to kind of go back and think a little bit about how medical communication has evolved over the years. So, going back more than 4,000 years ago, we see that, back in ancient Mesopotamia, there were no books, there was no paper. So the physicians who wanted to share knowledge with others, they had clay tablets, and they would inscribe on clay tablets, and that's how they would share remedies and medical salves and other information with each other. 1,000 years later in Egypt, we finally had a form of paper with papyrus, and finally there was the ability to write on paper, which was much easier to share and disseminate, although still it's a manual process. And so writing on papyrus in ancient Egypt was really not very different than what was going on 1,000 or 2,000 years later. So we have Galen and Hippocrates and all these other great medical thinkers over the years who still were relying on the manual process of writing with a quill or a pen or some other instrument on paper. And that was really the rate-limiting step in terms of disseminating medical knowledge. And then finally in the 15th century, we have a breakthrough, right? We have the printing press, and now we can finally mass-produce knowledge and get it in the hands of many, many more people who previously were not able to access such information. In 1665, we see the first scientific journals, and this is an image of the first edition of the Royal Society Journal from London, which is the oldest continually published journal in the world. And then finally, in the 1800s, we really have this era of great interest, both within academia, in the medical community, and within the broader patient and kind of more broad social communities, with people having an interest in healthcare. And so we see many medical journals being founded in the 1800s. The New England Journal was founded in 1812. The Lancet was founded in 1823. The BMJ was founded in 1840, and JAMA was founded in 1883. Yet, from the 1800s through the 1990s, there really was no change in the models by which these medical journals operated. They were still printing their journals and distributing them through the mail to their users, who would then read the paper copies. And then finally, in the 1990s into the 2000s, we see the invention of the internet and mobile devices, and finally we have many more avenues for dissemination of information and connecting an audience with the medical research that's coming out. And so it's very interesting to think about, how have these changed the models of medical journals and how they reach out to physicians, researchers, and the broader community. So after thinking about kind of this historical background, I think it's also useful just to talk about, what are the roles of medical journals, right? Why are they important, and what roles do they serve in our society? And I really see three main roles for journals. The first is facilitating the peer review process by which scientific inquiry really works. And then the second is sharing knowledge with other members of the medical community and beyond the medical community with the general public. And then thirdly, medical journals have always served as a forum for discussion and debate. However, now that we have the internet, now that we have other forms of communication, there are also challenges to medical journals. So fewer people are willing to pay for access to knowledge now that there's easy accessibility to free knowledge online. And other venues now are also offering medical knowledge that don't cost anything. So you can go on blogs, you can go on social networks, and through Twitter even you can find out about the latest research. And then finally, some of these other venues, such as social networks, are actually much more interactive and responsive. And so for those who really want to engage and have discussions, they may find that using a medical journal as your sole source of information is just too old-fashioned. So I'm going to spend the rest of the time talking about what we've done at the New England Journal to address some of these challenges and try to better engage with our audience. And there are two aspects here, right? One is the fact that we have a website, and we have the ability to use our own website as a vehicle for experimentation and connecting better with those readers who want to visit the website, and we can try to have a more interactive experience for them. And secondly, we can also look to social networks like Facebook, Twitter, and YouTube as another vehicle for connecting with this audience. Now, for 200 years, the New England Journal has been publishing letters, and that's been the main avenue for readers to engage with the content and to have discussions and debates. But even today, a letter will not be published for 3 months after the original research article was published. Versus over the last few years, we've been experimenting with online commenting, and you can submit an online comment and it's posted that day. So there's that immediacy that you don't get with the letters and the delay. I want to talk a little bit about geography, right? So the top map in gray shows the top print subscribers to the New England Journal. And not surprisingly, you see that represented are United States, Canada, Western Europe, Australia, Japan. And then in yellow, we see the top visitors to the New England Journal website. So now we have Brazil, India, China. And now looking at social networks, we see that the audience is even more geographically diverse. So the top 10 countries on Facebook following the New England Journal include Brazil, Colombia, Egypt, India, Indonesia, and Taiwan. And on Twitter, the top 10 also include Ecuador and Saudi Arabia on top of the other countries mentioned. So it's a very, very different audience on social networks than you'll see on the website or with the print journal. And it's a unique opportunity to interact and engage with this different audience. Thinking about the age demographics, we also see a very large difference. So the print New England Journal, more than 50% of subscribers are over the age of 50. Now, on the New England Journal's website, we see that the demographics skew slightly younger, but compared with the New England Journal's Facebook page, we see that on Facebook it's even younger still, such that more than 75% of the New England Journal's Facebook followers are less than age 35, and more than 90% are less than age 45. And so we've been proactive in creating interactive features over the past few years to try to engage with this audience, and it's involved a lot of experimentation. So we have a blog, we have an iPad app, we have iPhone apps, and we have a number of different features on our website. We have an image challenge every week in which we present a picture that was submitted by a user that's been subjected to peer review. And then there's a multiple choice question that's posted along with that picture. We've created interactive medical cases in which users on the website can read about a real case, answer a series of interactive questions, and then learn about a specific diagnosis and obtain a educationally rich experience in the process. In clinical decisions, we choose a controversy in medicine, and we invite authors to write viewpoints in response to a clinical scenario. So, for example, for prostate cancer, we presented a case of a 55-year-old man who comes to his primary care doctor and asks, should I get screened with a PSA for prostate cancer? And we had one author who said, absolutely. And we had another author who wrote an equally compelling case saying, you really should not. And then we put it out on our website and we let viewers vote and share their comments. And it's a robust discussion. And you see for prostate cancer, it ended up being about 55% of our online response was in favor of prostate cancer screening, even though the US PSTF has recently released guidelines advising against prostate cancer screening. So it's very interesting to see that discrepancy there. And then we can also look at the geographic distribution, and we see that the votes in favor of prostate cancer screening were different in different regions of the globe. So over the last year, the topics that we've done with these clinical decisions include HIV prophylaxis, mammography screening, physician-assisted suicide, medical marijuana, PSA testing, and whether families should be invited to be present for CPR. On average, we receive about 91 comments and over 1,000 votes per article. And more than half of the respondents who participate in these articles and vote are from outside of the United States. So looking at the data from our website, we see that the interactive features on our website are much more popular than our traditional articles. So the image challenge receives, on average, about 80,000 views per week. So moving over to social media, I think we've already seen one reason that journals should be interested in social media, and it has to do with the audience, right? The fact that it's not only a large audience, but it's geographically diverse, and it's a different audience than you can capture through a website or through a print journal. So as of the beginning of this month, the New England Journal's Facebook page had 459,000 unique users who had liked the page, and Twitter had 136,000 followers. Secondly, the audience on social media is growing much more rapidly than audiences in other venues, such that you see that the Twitter growth over the past 4 years has been exponential. And then finally, with the power of social networks, we can extend our journal's reach beyond just those who like us and friend us, but you can now reach friends of friends, so that we have a combined network that we can touch that's over 90 million people. So looking at the analytics from our Facebook page compared with our journal website, we see that on average, posts from the journal on Facebook are viewed twice as often as articles on the New England Journal website. So just other evidence that the reach is broader. And we also found that of the posts we have on Facebook, when they include an image, they're much more likely to generate engagement. So there's more likes, more shares, and more comments for the posts containing images compared with posts that do not contain images. And finally, I want to share something that I like to call the Ick Factor. So we had a hypothesis that images that were more graphic, that are more compelling, are going to engage users more and are going to generate more likes and shares and tweets. And so to test this hypothesis, we had one of our staff members actually look at all of the Facebook posts from 2012 and rate them on a scale of 1 to 5. So, for example, this image of an echocardiogram would receive an Ick Factor of 1, whereas this image of a patient with neurofibromatosis would receive an Ick Factor 5. So not surprisingly, you see that Ickier photos elicited greater engagement with more likes, more shares, and more comments than those photos that were not as graphic. Granted, this is based on just one user's subjective opinion, but my sense is, given the robustness of these data, if we subjected this to a more scientifically rigorous analysis with multiple blinded reviewers, I think we'd probably achieve the same results. So, in conclusion, the landscape of medical communications is rapidly evolving. Medical professionals are increasingly accessing journals online and on mobile devices. And interactivity is the key to success for journals in the connected age. Finally, through our own analytics, we see that the user response to images, polls, interactive features are the most robust. And thinking about ways to better increase engagement in the future, I would encourage anyone who's involved in medical research or medical publishing to think about using those types of features to better engage and connect with their audience. Thank you very much.